Okay, let's dive into a really important conversation in mental health care. We're talking about medication. What's its real role? Is it supposed to be a total fix, or is it more of a tool? Today, we're going to look at what it means to go beyond the prescription to build a real, lasting path to well-being.
So let's just get right to it. The big question. Is medication a magic bullet? The one thing that will solve everything? It's a really tempting idea for sure, and a super common one. And the simple answer? Well, it's no. But the real answer is so much more interesting and honestly way more empowering.
All right, so if it's not some magic bullet, what is it then? What's its job? The best way to think about it is as a powerful, incredibly supportive player in a much, much bigger picture of your well-being. Let's break down exactly what that means.
To really get the whole picture, we have to start with the positives. We have to appreciate what medication can actually do, because when it's used the right way, it can be an absolutely transformative tool.
Think about how these things build on each other, right? First, medication can help quiet the noise. It can reduce those really overwhelming symptoms, like the constant buzz of anxiety or that heavy, heavy fog of depression. And when that noise gets turned down, you can find some stability. It's like finally finding solid ground under your feet. And from that stable place, well, that's when you can start to really engage with your life again. It doesn't magically fix the problems, but it creates the space where you can start to work on them.
Now, just as important as knowing what it can do is getting real about what it can't do. And this isn't about calling it a failure or anything like that. It's about being realistic so we can use this tool in the smartest way possible.
And this part is just so crucial. A pill can't process your past for you. It can't heal deep trauma all by itself, and it definitely can't do the hard work of untangling difficult emotions. That's the work we do, through self-reflection and often with a therapist. I love this analogy. Think of medication like a cast on a broken leg. The cast doesn't heal the bone, right? It just holds it stable so the real healing can happen underneath. It helps you manage, it doesn't erase.
So you can probably see where this is all leading. Because medication has both this incredible power and these very clear limits, it points us directly toward a much more complete solution. And that solution is integrated care.
So let's do it. Let's look beyond the prescription pad. What does it actually mean to build on that foundation that medication can give us? Well, it means creating a support system that's truly holistic and really, really robust.
A real, effective care plan is like a living, breathing system. Medication is often just the starting point. It works in partnership with therapy, which is where you do that deep emotional work. And all of that is supported by wellness practices, things like sleep, exercise, mindfulness, that strengthen your body and your mind. It's all guided by education, so you actually understand what's happening on your own journey. And the glue that holds it all together? Ongoing reflection and adjustment with your care team. No single piece here can do the job alone. They all work together.
And when you put all those pieces together, it causes this fundamental shift in how we approach mental health care. It moves away from this old top-down model to something way more powerful, a truly collaborative approach.
I absolutely love this quote because it just nails the whole idea. See, healing isn't something that's done to you. It's something you are an active, essential partner in. You bring the most important expertise of all, your own lived experience, and your providers bring their clinical knowledge, and together, you co-create the path forward.
And really, this is the ultimate goal, isn't it? We're not just trying to check a box to make a symptom go away. We're treating the whole person, your history, your hopes, your entire life. The symptoms, they're just one piece of a much bigger, much more important puzzle, you. So, I want to end with a question for you to really think about. Taking all of this into account, the medication, the therapy, the wellness, the collaboration, what does a truly supportive, comprehensive care plan look like for you? Because asking that question, well, that's what puts you in the driver's seat of your own well-being.